The mouth, start of the digestive system. Okay, so the anatomy, real quick, you have the oral cavity. In the oral cavity, bound by the teeth, bound by the cheeks, you have the tongue inferiorly, you have hard, soft palate, uvula. So, uvula prevents flow of food up into the nasal cavity. And then you have epiglottis, which prevents food from getting down into the trachea. Pharynx is a fancy term for throat, divided into three sections. You have oropharynx behind the mouth, nasopharynx behind the nose, and laryngopharynx behind the larynx. The top of the larynx is also the top of the esophagus. So anteriorly you have trachea, larynx, and then trachea, and then posteriorly you have the esophagus. Tongue, large skeletal muscle. Okay, so if we look inside the mouth, you see the uvula in the back. Soft palate has lots of stretch receptors, cause the gag reflex. Gag reflex is actually important for initiating swallowing. Hard palate is corrugated, creates friction. Soft palate, we just talked about. Uvula prevents food from going up into the nasal cavity, and then that also has the stretch receptors that trigger the swallowing reflex. Tongue, important for repositioning food, part of the chemical sense of taste, but very little. Forms the bolus, also important for swallowing, speech, taste. In terms of secretion in the mouth, we see saliva, and there's two types of saliva. There's the constant production of saliva by the intrinsic glands, which just line the mouth, and that kind of moistens, keeps everything from drying out. And then you have the extrinsic glands, which include the parotid gland, submandibular, and sublingual gland. And that's where we see the production of enzymes. In particular, you see amylase, salivary amylase, that works to break down starches into glucose. Saliva taken together has a bunch of different substances in it. We see a lot of things that we're going to see through the rest of the semester in any secretion. So secretions are produced from plasma. So anything in plasma is going to be in the secretions. So we see water, electrolytes from the plasma. You see metabolic wastes like urea, uric acid. We also see, we talked about salivary amylase, mucin, which helps to lubricate the food. And then we see a couple of things to help protect against microorganisms, some lysozyme, IgA defensins, cyanide to prevent bacterial growth in the mouth. In terms of control of salivation, the intrinsic glands run fairly continuously to keep the mouth moist. The extrinsic glands are stimulated either by stretch of the mechanoreceptors, food, so the presence of different substrates on the tongue triggers the secretion, but you would also see parasympathetic innervation increasing salivation versus sympathetic innervation, which would inhibit that salivation. Pharynx, again, fancy way of saying throat. We have basically a long tube posterior to the nasal cavity, oral cavity, and the pharynx. The pharynx creates one of the biggest problems for us in that food goes in through the mouth and has to cross the breathing path from the nose anteriorly towards the trachea. The esophagus is probably the most boring organ in the digestive system. The longest food's going to be inside the esophagus is, a second and a half, 2 seconds at the longest. It's a muscular tube, stretches out, not very exciting. This just shows inside the esophagus, we see our 4 basic layers. So internally, so you have the lumen all the way in the center, and then this kind of lighter purple around the inside would be the mucosa. Then you have the bluish purple, which would be the submucosa, 2 layers of muscularis externa, and then this would not be serosa around the outside. This would actually be in adventitia. So this is the one layer where we don't have that serous lining. We have that fibrous connective tissue around the esophagus. So, summary of the processes in the mouth. In terms of propulsion, there's actually two types, right? So, listed on this slide is just deglutition, which is swallowing, we'll talk about in a second, but also mastication, chewing, listed as mechanical digestion, but that would also fit under motility in terms of some type of function. Deglutition happens in three phases: the buccal phase, the pharyngeal phase, and the esophageal phase. The buccal phase is the voluntary phase, and so this is where when you're done chewing your food, you use your tongue and you push the anterior portion of your tongue towards the hard palate, and that initiates the reflex portion that starts when mechanoreceptors are stretched in the soft palate. As a result, what we would see is that, and I always hate the way this picture shows this, but the larynx down here would be elevated, which pushes the epiglottis to cover the trachea. And so during this phase, the pharyngeal phase, the epiglottis, the uvula close to allow for food to go back posteriorly into the esophagus and prevent food from going up into either the nasal cavity or down into the trachea. Then we enter the esophageal phase, which is just one long streak of motility, peristaltic-like motility, where the bolus is pushed in a wave down towards the stomach. As we hit the gastroesophageal sphincter, that relaxes and allows food bolus to enter into the stomach. And when this last wave of peristalsis hits that gastroesophageal sphincter, now we're in the closed-off stomach.